Live Well, Living with Macular Degeneration under Covid-19 Restrictions by Suzanne Roberts of the Macular Society on the 20th of January 2022. About Live Well. Live Well is a series of events aimed at helping people make the most of life with sight loss. Live Well is a collaborative project between 7 local independent sight societies, which include Sight Advice South Lakes in Cumbria, My Sight's Knots in Nottingham, Sight Airedale in the Airedale area of North and West Yorkshire, Support for Sight in Mid and West Essex, Sight Concern Worcestershire in Worcestershire, Sutton Vision in the London Borough of Sutton, and Outlookers in Huddersfield, West Yorkshire.
Good morning, everybody. Welcome to our Zoom meeting today. We have Suzanne Roberts from the Macular Society. This is part of the what we call the Rainbow Collaboration. We do events every month, every week at the moment because of the Plan B. So every Thursday at 10 o'clock, we'll have a session like this, Quality of Life, Living Well, or we'll have something on technology for the next 3 months. We've got quite a good program, which we'll talk about at the end as well. But today, it's Suzanne from the Macular Society who's going to explain which bit she comes from and what she's going to talk about. So over to you, Suzanne.
Thank you. Lovely to see so many of you here. And thank you for inviting me along today. I'm speaking to you from the sort of Petswood area near Bromley, sort of southeast London, Kent way, and it's a very beautiful day. So yes, my name's Suzanne Roberts. I work for the Macular Society, and I've been with the Macular Society now for around 17 years. And in the last 2 years, I've been managing the counselling service. So what I'd like to do today is talk to you a little bit about the emotional impact of sight loss, but I also want to be able to allow time for us to be able to sort of talk as a group and sort of share some of your experiences. So this counselling service was set up predominantly because there was a realisation that there's such little sort of specialist support out there for people who are experiencing sight loss. So that's how the service sort of came about all those years ago. So I'll talk to you about sort of my experience of working with clients. I'll also refer to some of the clients that I've worked with and some of the sort of common themes that come up in working with the people that come through to our service. So I'll tell you about our counselling team. We're a team of 9 at the moment. And the actual service itself runs by referrals that can come in, say, from self-referrals from yourselves. So you could call our helpline and refer yourself, or you could make an online referral, or quite often referrals come in from eye care liaison officers or perhaps social workers, etc. And what we aim to do is to help that person sort of work through their difficulties and try and find a way through. Often, you know, people come through to us when they're newly diagnosed, or it might be further on down the line, but we're there to sort of advise, support. Everybody receives an initial telephone assessment. So if you refer yourselves to our service, you will generally be offered a telephone assessment within a week. So we're very sort of quick to respond to your call, because we know that when people reach out, that's when we want the support, not 5 months down the line. And we're really fortunate that we don't have a waiting list. We try and get to people very quickly to put them in the right place rather than them being sort of sat waiting. So once you've had your initial assessment, we will sort of talk with you and decide whether counselling sessions are going to be helpful. And that would be telephone sessions that would be normally around 6 sessions. Some people have more, some people have less, but there's a maximum of 12 in any 1 year period. Some people might also go on to other services. So say, for example, you might be referred to the counselling service, you may have an assessment, and we decide that actually it's more kind of a feeling of loneliness and just wanting to have a friendly chat with somebody rather than the counselling service. So we have befrienders or befriending service within the Macular Society that we may well then refer you to. Some people may go on to a referral to social services, Age UK. It's whatever you need and whatever's going to be sort of most helpful to you. And the service is available to anyone who has macular disease, but also family members. So we get referrals from, say, for example, sons, daughters. We get referrals from parents. And sometimes we might have a referral from somebody who then says, my husband's really struggling with this. He'd like somebody to talk to. So we don't forget that the partners and the family members, often they're struggling too. It's not just the person themselves. And often family dynamics will change because of a diagnosis or because of a deterioration in sight loss. So basically we want to sort of be able to talk to you, pull your story together and think about what's really going to make a difference. Is that with us and our services, or is it also involving other services or your local sight loss charity, etc.? So that's kind of the counselling service. So if I go on to the emotional impact, if we think about having sort of any kind of diagnosis, and obviously particularly sight loss, often the emotional impact is overlooked. So the focus is much more likely to be on visual aids, what you can see, what you can't see, do you need to be registered, etc., etc. Lots of leaflets and lots of signposting. And all of those things are obviously necessary and they are important. But what's just as important is how people feel and how people cope. And often there is very little attention given to that. Even as people are diagnosed or as people go back to the hospital, I'm sure many of you will relate to this, or if you're having injections, it's often all about the treatment or the eye scan and not necessarily how do you feel, how are you coping, how is this impacting on your life? And sometimes I think that's a fear because sometimes the professionals might feel they don't have enough time, or for whatever reason, it's just not being addressed as well as we'd like it to be. And clients will say to us that they've got so many questions, and often they'll feel that they themselves just pick up on that there isn't time to ask those questions. So there's normally quite a lot going on in somebody's mind when they're actually at the hospital or at an appointment, but probably a tiny little percentage of it actually gets addressed. And also right now, we're going through this pandemic. Who knows how long it's going to last for? We go in and we go out and it keeps changing. But it certainly had an impact on the level of referrals that have come through to us, which have increased, with people telling us that they felt very sort of anxious, they haven't gone out as much. Naturally, people haven't socialised as much because there's been times when we haven't been able to do that. So that's had a real impact on, I think, social isolation, anxiety, and also where many people haven't been going out as much. Lots of people have lost confidence. So there are people who would quite happily go to their local shop, and then because of lockdown and because they haven't been going out, there's a real sort of apprehension about doing it again. And I think that's the same for any of us. If we've got any kind of fear and we don't practice doing it, we become a bit sort of rusty and we tell ourselves that it is really frightening, so perhaps it's best not to do it. So there's lots of sort of challenges, if you like, that have arisen throughout the pandemic. And if we think about referrals coming through to us, so if you think about all of yourselves and the people that you know that have macular disease, nobody is dealing with macular disease on its own in isolation. So we know that if somebody comes through to us who's diagnosed with a form of macular disease, there'll obviously be lots of other things that will be impacting on that person's life as well. And I'll just give you some of the examples of, sort of clients that come through to us. So it might be a parent who has a child who has the diagnosis. So they may be really feeling very fearful, because as a parent, we want to protect our children and take anything away that might make their life difficult. And also they may be fearful of their, the sort of impact on other children, or whether this is something that will be genetically passed throughout their family. Many people have other health conditions or mobility issues, as well as the diagnosis with their eyes. Or you may be somebody who's caring for a partner and may be really fearful of, how will I carry on in this role? How will things sort of continue? And many people that we speak to have sadly experienced the loss of a long-term partner, husband, or wife. And that person may have made sort of your sight loss a lot easier to cope with. Because often if you're in a relationship, a good relationship, and one of you has macular disease and the other doesn't, it's almost like you sort of can share roles and tasks. And then if that person isn't around anymore, it's like experiencing another trauma or re-experiencing the sight loss again, because you'll become much more aware of it. And of course, there are many of us that might be prone to anxiety or feeling low, and a diagnosis such as macular disease, or if there's been a change in your vision, could trigger a relapse to feeling low again and to feeling anxious. And of course, that could happen if you're not naturally somebody who feels anxious or feels low. That could just be a response to what's happened. So life goes on, sort of even after the diagnosis, life goes on, but we're all living in different environments and different incomes. Some of you may live close to transport links, others of you may live further away. Sometimes people have friends and family close by, and other times they don't. So many occasions now I speak to people who've got family who are living sort of dotted all throughout the country. So even though they have family, they don't see them very often. And again, the pandemic has played havoc with all of that as well. So many people will say the sort of classic saying, well, we're all in the same boat. Yeah, and I think in a way, we're not really, because of all the things that I've just listed. So there are things that will make your ability to cope a lot easier, and there are other things that will make it more difficult. And as well as difficulties, there will be things that happen in all of our lives that make things more enjoyable, whether that's the birth of a grandchild, or, I don't know, something lovely happening in your family or with your friends. There'll always be those things that perhaps can remind you that there's, still a lot of joy to be had in life, I suppose, once you've sort of dealt with that initial diagnosis. So I'll go through some common themes and sort of feelings in living with sight loss and see what you relate to. And these are taken from clients that have come through to us at the Macular Society, because I think with any of these talks, from my perspective, it needs to be real. So it needs to come from the people who actually have the condition. So you'll notice that some of these themes will link to the cycle of grief, if any of you have ever looked into that. I'm not going to go through the cycle of grief at the moment, but you'll probably notice there will be common themes. So the first one I'll refer to is the shock and the fear, especially at the initial point of diagnosis. It feels so raw when people come through to us, and you can actually either hear the fear in their voice, or if you're reading a referral, you know, people will say, I'm so frightened. And I think, you know, that sort of really touches me, that moment of just feeling that fear and feeling terrified about what the future would hold. And people will say things like, I thought I just needed new glasses. I've always been healthy. There's never been a problem with my eyes, and nobody in my family has this, just me. And there will naturally be a lot of questioning, because when we're feeling anxious, generally we want answers. So there's that sort of questioning and there's that searching. So the questioning might be around you know, what will happen now? How will I cope? You know, will I be able to live on my own? Lots of things around the future. For some people, there might be a period of denial where they might not want any association with anything to do with sight loss. They might not want to link with any sight loss services, and they might not want to read any leaflets, etc. And I don't always see that as a bad thing. I suppose it depends how long it goes on for, but I think some people just need that bit of time to kind of absorb the information, and for them to sort of reach out to others when they feel ready and not to feel forced into it. Anger comes up quite a lot in terms of sort of, why me? Haven't I been through enough already? Feeling frustrated. There's people planning on different events in their life or retirement, and just feel that this has all come along sort of all at the wrong time. Not that it would ever be a good time, but people will often say, everything that I do involves my eyes, so what will I do now? And there's that feeling sometimes, I think, of total despair, especially in the early stages, or where there's been a sort of a change in vision that's impacting on what you can and can't do. So some people may have had a long period of time where they've thought to themselves, if it stays like this, I can cope with it. And then there's been a change. So there's a real sort of spectrum of sort of feelings and what people will go through. If you know anything about sort of the grief model, there's the final sort of stage is acceptance. And I think acceptance is such a huge thing. I don't know if anybody is totally accepting. Some people may say they are. Perhaps it's something you could mention. But to me, I see acceptance. It's when that person is in that stage where they're not sort of consumed with the what ifs and with the fear. They're able to kind of get on with their life and have some kind of normality. And clients will say, well, you know, I'm starting to feel better. And I'll say, well, you know, how do you know that? What tells you that you're feeling better? And often they'll say, because I'm starting to feel a bit more like my normal self, you know, and whatever that is. And I think we can all relate to that. If you go through a period of feeling really stressed or feeling really down, you know when you start to feel a little bit better, a bit like you. And I think it's always a good sign when I call people and they say, well, for example, like today, I've joined my local sight loss charity. I'm going to go on to their Zoom, or I've started volunteering, or I'm going to meet that friend for coffee. It's always a good sign that that person is taking action and is kind of being proactive again. So I'm going to give you some feedback now, which is feedback from a client, so a real client who came to the Macular Society a number of years ago, who did manage to move on from this stage, I must say, but I will read it to you because I don't think sadly, it's not a rare example. So this is what she said. I was told very bluntly that I had macular disease. I'd never heard of it. I was told I wouldn't go blind. At the end of my appointment, I was shown out of the consulting room and down a corridor where there were leaflets, and I was encouraged to take some information away with me. I was desperately trying to hold it together and not to cry. I made my way towards the information board, and it was there that I burst into tears. I felt overwhelmed. I took some leaflets, I left the hospital, and I decided I never wanted to go back. Now, not everyone receives a diagnosis or reacts in the same way as this client, but sadly, as I said, it's not a rare example. And we know from speaking to you that if you're given a diagnosis in a kind and informative manner, and somebody sort of even gives you a card and says, you know, you can call this number, or they'll be able to offer you some support when you're ready, I think people respond much better than being told quite bluntly. And the ophthalmologist may not realise that their approach or their manner is as blunt as it is, but quite often people are given a very blunt diagnosis with very little explanation. And at that time, if you can remember, or we think about any major diagnosis that any of us have had, it's very hard, isn't it, to take on board what the person is saying to you, because your mind is racing at what does this mean? You know, how will this affect me? Your mind is probably already racing ahead. So it's really hard to absorb that information at that moment in time, but perhaps knowing that there was an ECLO at the hospital, or that you could call the Macular Society or your local sight loss centre, etc. Just having a little bit of info and a bit of kindness, I think, would have made all the difference to this lady. And what happened was, she said she was never going to go back again, and they booked her in for another appointment. And she had some counselling sessions with us, and we linked with the counselling service at the actual hospital and managed to get her to go along to talk about her experience. So even the fact that she went back in through the hospital doors was huge for her. So she had some sessions there and she felt a lot better, but she was not very forgiving, should we say, of the way she was given that diagnosis. So there's a lesson there, I think, for ophthalmologists or anybody giving news like that. Now, what I'll do is I'll stop here, only because I'm aware that it's 10:30. And if I need to sort of carry on or you know, elaborate on anything, I will. But I think this might be a good place to kind of stop and then see what kind of a discussion or what questions we've got, because I think it's far more interesting for you if you take part and you share with one another. Is that okay, Susanna?
Yes, thank you, Suzanne. Would anybody like to say something or ask a question?
Has anybody had sort of an experience sort of similar to the lady I mentioned in terms of how you were diagnosed?
Yes, I have. It's Janet.
Hello, Janet. Hi.
Hello. I was sent to the hospital by my very nice optician, and she said, I think you've got macular disease, but I want it confirmed, so I'll send you to the hospital. He was the top man in the eye clinic. He was in charge of the whole clinic. And he told me, yes, confirmed, you have got macular disease. If you go blind in one eye for any reason, you must get to the hospital or the opticians again as quickly as possible. And then he almost said, next, please. That was the end of it. And that's how I was told. But that's, you know, nothing else, just that.
That feels so harsh.
It was hard. It was hard. But I didn't cry. I just felt angry. And I felt angry ever since, really. Because there isn't any kindness, really, up there at the hospital. You're just, you know, you're not a person. No. But I'm on the very end now. I might need counselling soon, I think, because I'm at the other end.
Okay, and you can come through to us. I think
Yes.
I know people are reluctant sometimes to give feedback to hospitals or ophthalmologists, but I think that's the only way they really, learn, in a sense, is that if we're able to give them feedback to say at the hospital that you felt that that was really unkind, and perhaps, a little bit more explanation would have made such a difference. It's more the bedside manner, isn't it? You
Yes.
say it's that kindness.
You never see a consultant now. You just get a remark on your notes. So you never see a consultant at all.
No.
It's just everything is virtual.
Oh, okay. And I think for a lot of people and people who are listening, with a lot of things being virtual or on the telephone, I think for many that has not felt, well, it hasn't been like a normal appointment.
No, it doesn't feel like a normal appointment. No.
Yeah. Okay. And what about the sort of, has anybody else felt this sort of feeling of anger, or sort of the frustration? The word frustration comes up on a regular basis with our clients constantly.
Suzanne?
Yes.
I would agree with your colleague. I mean, I'm Shirley. I was diagnosed, and ever since we've virtually been in lockdown, I have had 2 phone calls. I saw somebody, they kept putting it back, and they put it back, and I should have gone in January. It's now going to be possibly in February. I haven't had the help I should have done. And I think it's quite a shame, because the problem is deteriorating. It was picked up by my optician, very professionally done, lovely, wasn't it? It was really, really good. She explained to us. She was very, very helpful. She wrote the letter. I've got other eye problems as well, so it's not good. I think we've taken a real back knock. And the other thing that I've heard from so many people is that they've not allowed, if you go to an appointment, you're not allowed to take anybody with you. Now, a lot of people find those sort of comments that are made, you need that emotional support, because they pick up things, to me, the way that they treat you when you go to the hospital now, and they say, you can come in, but you can't. It isn't helping people, is it?
No, I think I agree. That's a really important point. And I think you can say that you want that person to come in with you because you have a visual impairment. So you can say that. My dad has sort of early stage dementia. So if I go with him to the hospital and I've been stopped at the door to say, no, only the patient, and I've said, look, he's got dementia, or I'm a carer, even though you don't possibly want to say that, in some aspects the other person is, in a sense, even that's a minor part of caring. We're not thinking about full-on caring, but it still means that because of a disability, you need additional support. So you can say, my husband needs to come in with me because I have a visual impairment. So you can say that. And I think you're right. And I think everybody on this call will agree that if you're in a hospital appointment, there's lots of information, and it's really helpful. If you're fortunate enough to have someone that can go with you, it's really helpful that they can either go along with a list of questions that you might want to ask and write down the answers, or they can sort of just take notes for you.
The other thing is, Suzanne, I don't know if any of the people that are with you have had the same problem, but unfortunately, due to my husband's condition, we've been isolating for nearly 2 years now. Haven't been able to have an optician appointment, haven't been able to go to an optician. So many of them now are not offering any services. I've just spoken to the community team today, And they're going to actually arrange for somebody to come to both of us in February to have our eyes tested. But when you go to the hospital, they say, oh, you've got to go to the optician. But they don't understand what it's like out there for certain people.
Yeah. And it's a difficult choice, isn't it? I think for everybody, particularly those that are medically vulnerable, as to whether you do go along for your eye appointment. We found with the Macular Society, particularly in the early days of the pandemic, there were people that were booked in for injections and were really sort of afraid to go because they're kind of weighing up, what happens if I don't go? What happens to my eyesight? Will it deteriorate? Or is there a chance that I could catch this, COVID, if I go along to the hospital, which for some people, could have awful consequences. So is there anybody else that's listening that's been sort of isolating and finding things difficult emotionally, or can relate to what Shelley's been saying?
No, but the lady before that who said that she couldn't get an appointment, I'm in the same boat. I should have had a scan. I usually have one injection and then one scan 2 months later. It's 3 months since I had an injection. So I'm due for a scan. And I rang up yesterday and she can't offer me anything until the 18th of February. That will be 4 months since I've seen anybody. And my eye, the one eye I've got a bit of sight in, has definitely got worse. And she said, well, there's hundreds of people, she said, as if to say, well, you're not even on the list. They don't even carry out what is said on the notes, because the last time I had an injection on the 19th of October, the lady who does the injections, and I know quite well now because I've been for several years, she said 2 months and you'll definitely have a scan. And they take no notice at all. So, and also the clinic wasn't open for months and months during the pandemic. And it's just, it's making our sight much worse, all this dillying and dallying about.
That's not good, is it? Particularly if you've noticed deterioration. I know at the Macular Society, where people have been in these situations, that I think the Macular Society keep a list of secretaries of the ophthalmologists, etc., at the hospital, and sort of try and put you in contact with the secretary. But no, it's not good if you're due an injection, definitely not. At the same token, I speak to people who are diagnosed and still get their injection within the 2 weeks as recommended by NICE guidelines. So I think it sadly might depend where you are.
Oh, definitely. I'm sure.
But it might be worth, you could always phone the society, the advice and information line, and just speak to them there. And maybe ask for the secretary's details, because this is your vision, and I'm sure everybody would agree. There's people will say there's nothing as important as my vision, in terms of our senses. So I think that's worth following up, particularly if you've noticed a deterioration.
Yes, I have.
Yeah, definitely
also,
follow up.
Yeah. Also, the lady said, we're all told we can't have anybody to go in with us, but my sister takes me. And because I've got mobility problems as well, I have to say, this is my sister. She's my carer for the day. I can't go in there unless she comes with me. And they do relent then.
But she's older than you.
And in a way, it shouldn't be a case of relenting, should it? Because you've got additional needs. And I think because macular disease is an invisible disability, in a way, it goes against you if you're somebody that looks fit and healthy, because nobody can actually see.
No, that's right.
You may well struggle if you're in the waiting room or you're being directed to another room. So I, again, encourage people to say, I've got a vision impairment and this is my carer.
Yes.
And that they have to actually go in with you rather than struggle. And it feels so unfair. Why should it be more difficult for you? This is a disability. Yes. So I'd encourage everybody to do that and to not going on their own.
So I'm iPad. I'm Brian from
Hello,
Sutton.
iPad.
Hi, Brian.
And I'm lucky by the sound of it. I lost the sight in my left eye 30 years ago, and then 4 years ago got wet macula immediately, almost outside Specsavers in Sutton. The chap there who'd been dealing with me immediately wrote a letter to my GP, and I was at St George's Moorfields within 2 hours. And because I was one-eyed, they gave me my first injection within 6 days. I've now had 23 injections there, 4 weeks, 6 weeks, 8 weeks intervals. It's brilliant. And now, hopefully, that's my last injection. I also nipped across immediately to Sutton Vision, who were brilliant and gave me 2 magnifying glasses, because the first 4 or 6 months, it was horrible. Because being one-eyed, I didn't know whether the injections were going to work. I obviously had to stop driving for 2 years. When I got my license back, my first trip to Wisley, some clown hit and run me. So my confidence went down, which is the point you're making. So for the last 3 years, I haven't driven at night, although my eyes probably are okay, but you start to lose confidence. But having said all that, I'm lucky compared with the 2 previous people. And just jumping across, I do a bit of work with Sutton MS for the last 20 years. And a lot of our newly diagnosed people with MS say exactly the same thing about specialist doctors, just talking to them as if they're dirt. You're just number 46 today. And somehow it's educating the specialist doctors. Having said all that, I can't fault Moorfields. I know a lot of people don't live near Moorfields franchises, but they have just been brilliant, and they give you confidence that if they say you've got to do X, Y, or Z, you do it, because you know you're dealing with people who are, aren't talking down to you. So I've been really lucky, I think, both with Sutton Vision, Sutton Specsavers, my GP, and St George's.
Specsavers have been open all the time, because 2 of our daughters got appointments and new glasses. And I think I've been in the last 2 years. So I don't know whether Specsavers is better than some of the private. Well, no, they are private, opticians.
Independent.
I know they also do home visits for eye tests as well. So although people sort of think, well, Specsavers, cheap and cheerful, I just really can't fault them. And my previous consultant, when my first eye stopped working, he recommended, ironically, us to go to Specsavers. So maybe at Sutton, we've been lucky, but you just can't fault them.
Oh, that's so good, and such a positive story. I hope you can work on building up your confidence again.
Thank you, Brian. Dennis, would you like to come next?
Yes, I'm Dennis. I live near Kendal in Cumbria. So Suzanne and Tim know me fairly well.
Yes.
I have no sight problems myself, but I'm a volunteer for sight advice. But my wife has developed a problem a couple of weeks ago. And it's sad to hear the stories of treatment and care that's being put across the board today. Totally contradictory to that is what we've had, the treatment and care that we've had. When I saw the local doctor, she had a problem with her eyes, and when I saw the doctor, immediately had an appointment the following day with an optician in Kendal. It was checked, and she had a partially detached retina, and immediately went to hospital. She'd had injection treatment, all the care that's possible, and things will improve slowly as it is, but the care and attention really unfortunately, I think it depends on where we are, but certainly it's different up here in Cumbria insofar as, I was at a hospital yesterday for other treatments, and the wife came in as my carer. And it says on the door, big notice, only the patient allowed in, nobody else. There was no issue at all. They're very compassionate here, and just putting the other side of the coin, really. It's depends where you live, and I appreciate that, further outside Cumbria, they're under a lot of pressure even more so with COVID, and that's obviously been a big issue for quite a few years. But sort of in a sense, I'm just sort of singing the praises of what we have up here. And just another slight aside, she did ring sight advice for advice and got it.
Oh, brilliant.
Could I come in there?
Of course you can, please.
It's to follow on what they've said about Cumbria. I was having treatment all during the COVID, and instead of stopping it, they increased the treatment, and they gave me injections, even though I didn't necessarily need it, so that they were sure that I wasn't going to need treatment in between times. And it meant that they could get more patients in. They were very highly organised. While I'm talking to you, do you think we could make it much more aware to people to have a look at the site themselves and pick up the very early signs of macular degeneration? I suppose I was fortunate because my father was an optician, but not in the days when they looked at diseases. He only used to test the eyes. That was all they did in those days.
I think yesterday, actually, I was at Specsavers myself. They're obviously having a bit of a feature here today at Specsavers. And I asked the ophthalmologist there, I said to her, I'm from the Macular Society, and I said, where are our leaflets? And she said, they're definitely here somewhere. And she went and she got them. And I said to her, what happens when somebody gets a diagnosis? And although it wasn't her area of expertise, she said that they are given information, and they're given an AMSLA grid, which is what you were just mentioning about monitoring your own vision. So I'm sure everybody has seen the AMSLA grid, where you've got a grid and you've got a black dot in the middle, and you're encouraged to look at the grid sometimes once a week. Sometimes people are told to look at it every day and make sure that you can see the whole of the grid, so you haven't got any of the lines obscured, and also that they're not wavy or they're not getting more wavy. And I think that would apply to the lady who hasn't had treatment and has missed out on her injections, whether you've monitored that, or whether people are doing their own form of monitoring, not to the point that it becomes obsessive, because particularly in the early days, for some people, it can be.
Yeah, well, it meant that at least I discovered I had dry macula. And so after that, I kept looking at it really. And then one time I realized that my sight had suddenly gone. And then, of course, it was wet macula, and I started treatment very early. And at present, I don't really need, I go each 8 weeks, but I don't, so I'm extremely happy with the treatment we get here.
That's good.
Great news.
Thank you.
That's good.
Can I throw
yes,
one more thing in?
Of course, Dennis, please.
Many years ago, and some people might agree with what I'm going to say, some people will say no, but many years ago I suffered from floaters on the eyes. It's not as severe as what we're experiencing here today, but I read on the internet something, and I tried it, and I'm the only person in my whole family, and around me there's about 10. I'm the only one that doesn't wear glasses, and it recommended parsley. Now every day, parsley. Now every day, one way or the other, I have half a teaspoon of parsley, and I put it in a sandwich, on a salad, mix it with other things. But I have half a teaspoon of parsley every day, dry parsley, and if I can get it fresh parsley, and I have no eyesight problems at all. That's all. Just for if you have it, and I've suggested it to the wife, and she started having the parsley, and her eye has improved. I feel it's a great thing to do, and let's say it works for me. Because I've not had floaters for if I forget to take it for a couple of days, the floaters come back.
That's interesting.
It'd be interesting to find out what vitamins or minerals are in the parsley.
But it really, really works. You know, I'm not qualified or anything, but it works for me.
I think that's
lutein. Could it be lutein? Because that's in green vegetables, and I mean that's what Brian has to be eating: broccoli and
spinach,
kale. Yes, and the Morpheals. Some of the doctors said, yes, do it. You know, my brother's got the problem, and I'm telling him take lutein tablets. And so we sort of think, well, we buy the lutein tablets and eat green vegetables because you can't do you any bad, can it?
Exactly. I think that's the key thing, isn't it? It's not going to do you any harm.
Yeah. I think I think it's important to point out though that if you're on warfarin and you eat green vegetables, they do have vitamin A in them, so you do need to be a little bit careful if you're taking warfarin.
I can't eat broccoli. I'm not allowed to eat broccoli or cranberries.
My consultant recommended me to take Vitise 2. Yes, I think that was it, because there'd been trials on it, because I was taking something else that was similar, but he said, well, there's been trials on this. I just wonder whether that's why I'm not having to have injections regularly now, because I haven't had them other than during COVID. I haven't had injections for years now.
It could be.
Thing is, I suppose you'll never know. It's sort of the $1 million question, isn't it? And I think it's a case of everybody just finding out what works for them and what they feel comfortable with. Because if anybody rings the Macular Society, and I think I'm correct in saying this, that they're always advised to eat as healthy a diet as they possibly can. And I think it's really important, the dark green leafy vegetables would be recommended. And it's really important to bear in mind that if you've got a condition where you shouldn't eat so many of them, that's important to take that on board. But always the healthy diet is the thing that is, encouraged as number one, as well as protecting your eyes from the sunlight and not smoking. And all the normal things that we do to keep ourselves as healthy as possible, like keeping yourselves hydrated and having exercise, trying to sleep as well as you can, all things that put us in the best possible position just to deal with life in general, as well as sight loss and anything else that we're up against.
Thank you, Susan, so much for coming to see us again today.
A pleasure.
We still have a couple of minutes if anybody would like to make a last comment or ask a question. But if not, Suzanne, can you just again, just really quickly talk about the referral to Macular Society?
Yeah, sure. So if anybody feels that they're really sort of, they're struggling basically with their emotions, be that you're feeling anxious, you're feeling low, you've lost a lot of confidence, and you just feel that you need, somebody to sort of talk it through with, you can make a referral via our helpline. So I'll give you this number, but no doubt it can be shared with you as well. It's 0300 and then 30 111. So 0300 30 111. That's our advice and information line. So you can call that number and say, I'd just like to make a referral to the counselling service, and they'll take down all of your details, and then your referral will come through to me, and then you'll be contacted to be offered a telephone assessment. So you can do it that way. For those of you that are online, you can go on the Macular Society's website, and there'll be a section under counselling, make a referral, and you can do it that way around. So it's pretty straightforward. You get contacted very quickly, and you could look at it as just an opportunity, even if it was a one-off, to talk things through. And then you might decide that that's enough. You don't need to do any more. So you don't have to think of it as, oh, I'm not sure, and this is making it a huge commitment. You could think of it as just sort of a bit of exploration, really, to sort of talk this through, and do I need extra ongoing support or not? So that's how you make a referral to us. And we don't have a waiting list at the moment.
Which is the best thing about Macular
Yeah,
Society.
it's very, we've got lots of assessments coming through, but we're trying not to have anybody
No,
waiting.
you don't. You
Got
really
lots
don't.
of groups. So, yeah.
Brilliant. Thank you so much. Thank
You're
you.
welcome. Thank you for having me.
Live Well and Future Vision. We hope you enjoyed this presentation. The Live Well events take place on the second Thursday of each month at 10 a.m. Future Vision sessions take place on the fourth Thursday of each month at 10 a.m. and are technology events aimed at people living with sight loss. To attend the next session or to suggest future topics, please contact your local sight society who will be able to provide you with the Zoom link.